Philippine economy for a change in the midst of a perfect spring. Why is that? Basically because what was once an indictment of the Philippine economy, that we couldn't find jobs for our people and we had to get OFWs out of the country. Today, these same OFWs have become our heroes, bringing in what? $22 billion a year. What was once something that we cursed government for and cursed our nation for is suddenly a savior. Interest rates are at very low points in history, 2-3%. Inflation rate, historic lows, less than 3%. We are now the darling of foreign investments. They're coming in and pouring in their money. Gross international reserves have risen, and for the first time perhaps this year, we will hit 100 billion in gross international reserves. Never has all of these events come at one point in our history, such that people are now saying that from the old man of Asia, we are now being counted as the next tiger of Asia. But let's all hold on to our horses, because I think the state of the Philippine economy is in a bipolar state. Doctors know what it means, and if you've seen Silver Lining, you don't need to describe what bipolar is. At one end of this economic extreme spectrum is robust, vigorous growth. BPOs, employment, structures, housing, banking, they're all on high mode and high gear. But what about the other side of our economy? We still have more than 50% below the poverty line. We still have hunger, we still have diseases. These are still in the shadows of our economy. And therefore, you and I, Rotarians and HMOs, are basically together because we focus in the shadows of the economy. These are the people in the peripherals. And I'm so sad to recall that I was talking on the telephone to a friend and telling him how great the economy was going to be this year and how we were going to make better projections of sales and income. And I put down the phone and my driver looks at me and says, "Sir, sana makatikiman kami ng economic growth." This is why the issue today is inclusive growth. It cannot be pure growth economically because we're just going to make those who are capable and rich enough to take advantage to become richer. But all those who are not able to take advantage has no impact on their lives. And this is where the HMOs really come in. We serve the shadow side of our economy. And how do we do this? Let me first premise it by saying all economies, all nations have in one form or another in their constitution the statement that the right to health is a right of every citizen. It is not a benefit, it is not a privilege, it is a basic human right. And yet, like all promises are meant to be broken. Why is it that none of them can truly deliver this promise? Because of the scarcity of resources. In our country, for decades, for 50 years or more, the allocation of our national budget has only less than 3% to healthcare. Imagine your budget of, let's assume, 1 trillion. This year they're saying a budget of 1.4 trillion. That 3% is minuscule. How many of that 3% will go to salaries and wages of our government employees working in health? How many of that 3% will go to payment of facilities and upkeep of hospitals and clinics? At the end of the day, how many will be left to really start new projects? Hardly any. And that is why, over the past decades, we have not seen the foundation of healthcare being built. We are simply crawling along. Number two, we compare ourselves to our Southeast Asian neighbors. For 20 years ago, private sector was 60% in our country to total health. Government was 40. Today, private sector is 70, government is 30. What does it simply say? That the private sector has to fend for itself because the government cannot have the resources to continue. But you compare that to Vietnam, to Malaysia, to Indonesia, Singapore, all of them show that the government component to total expenditure has risen and the private sector has gone down. So the first reason is the scarcity of resource. Second major reason why health is so difficult. Medical inflation has gone far beyond normal inflation. Imagine in the Philippines the CPI, the Consumer Price Index. It says 3%. But our Consumer Price Index is made up more than 50% by food. And health is only 5%. Even if health of 5% was to double, its impact on CPI is meaningless because it's so small. What has happened historically? Salaries and wages would grow together with inflation rate or slightly higher. But medical inflation would always be astronomically higher. Over a period of years, less and less people will be able to afford, such that our healthcare situation will truly come out a divide between the rich who can afford and the poor who will not be able to avail. The United States faced a problem, and in 1973 they said we have to stem the tide. They came up with an HMO bill in Congress in 1973, which we promptly copied in the Philippines. But imagine in the United States, the richest country, the most powerful country in the world, has to solve a problem by HMOs. You bring that problem to the Philippines. We're beginning with more than 50% below poverty line. So what happens is that here we have a nation, good education, graduates from medical field. They go back to the provinces to practice. They cannot find enough patients who can afford to visit them. So what happens? Our doctors go abroad. We suffer a brain drain. Many of our doctors, surprisingly, are willing to become nurses in Canada and in the US. So the truth of the matter is, unless we do something about it in this country, we will continue to suffer the drain. So HMOs created, and what do HMOs do? The only purpose of an HMO is to cost manage. When you say cost manage, you say give the people what they need. Control the cost of that need, but you have to stop giving the wants. Ang wants, insatiable yan. The need is fixing. So when the HMOs were created, they were given the power, in effect, to negotiate with the providers. Today, the Association of HMOs in the Philippines have more than 3 million members. We, as an AHMOPI, negotiate with the doctors, from the society to the College of Surgeons, Pedia, OB-GYN, and the like. We sit down with them and we said, Doc, pwede ba may 3 million plus kaming members, i-focus namin sa inyo, bigyan nyo naman kami ng discount. Very, very clear example would be this. You go to Makati Med, for example, today, the consultation will be between 1,000 to 1,500 per consult. If the doctor is a member of the AHMOPI, an accredited member, our member will go to the doctor and he will show our card and we pay the doctor. You know what the doctor has agreed with us? He has agreed to be paid 300 pesos. But what do we promise? It's 300, but we give you 20, 30 patients a day. So what value is your 1,000 or 1,500 per consult if you only see 2 or 3 people? Here we're giving you 20, but at 300. We go to the hospitals and negotiate, and we say, St. Luke's, Atimed, and City, Riverside, wherever. And we say, HMOs are 40 to 60% of your bed space. If we do not cater to you and we pull out, your hospital will only have a 40% capacity utilization. Give us discounts and we will increase our utilization in your hospitals. And therefore, we get the discounts because we promise them volume. The individual has no power or strength in negotiation. But as HMO group, we use the power of numbers. All these discounts, binibigay namin sa members, hindi sa HMO. All of these discounts, all of this consultation fee, all of these operations and surgeries that doctors do, all discounts revert to the individual members. And the HMO simply manages the program. On average, if you were alone, you would spend 1 peso. If you were with an HMO, you would probably spend 50 centavos. And the HMO will say, we will charge you 10 centavos of that 50, but we will save you 40% and we will run the program for you. So today, we have about 3.5 million members of the HMOs that allows us nationwide scope of coverage. Itong problema sa Philippines, so foreign companies come in, mga HMOs come in, from Aetna, United Health, they come in. And in 3 or 4 years, they get wiped out. How is it possible that the originators of HMOs in that country cannot survive in our country? And local guys that we are surviving. They do not understand the idiosyncrasy of our market. They think that statistics is sufficient. In this country, statistics are never sufficient. Why? Because of poverty, people will abuse the program. For example, a mother has his child, her child may asthma attack. Dadalhin niya ngayon sa doctor. The doctor says, nebulizer ka niyan. And you buy this medicine. Sabihin ng nanay, wala akong pera. Dok, naka-HMO naman kami. Pwede ba? Ipasok ko na lang yung anak ko sa hospital overnight. Pag overnight sa hospital, bigyan mo na ng nebulizer doon, tapos lahat ng kapot na kailangan. And then tomorrow, pag labas niya, kompleto na. The foreign companies never understood that this practice exists in this country. They think na walang kayaan, na walang abuses. Abuse in our country accounts for almost 20% to 30% of increased cost. Unless you manage this will go on forever. So, on the whole, let me just bring you back. This is the essence of an HMO, and what is our prospect for the future? Simply put, the prospect is this. The management guru, Peter Drucker, says that if you have to predict the future, there's only one thing that you can count upon. Everything else is guesswork. The only thing that you can count upon is demography, population. Population does not change over 1, 2, 3, 4, 5 years. Population changes in 10, 20 years. When I graduated in college, the average age of the Filipino was 18 years old. Today, as I stand here in front of you, our average age of the Filipino is probably around 28 years old. Whether we like it or not, in the next 20 to 30 years, the demography of the Philippine population will age. And as we age, the requirement of health will simply increase. And that's why in the whole world, they say that the medical field is the best business to go into the next century. If that is the case, we must be able to master the resources of an HMO and get people educated as to its purpose. We can only touch more of our countrymen to join the HMO if they understand that they sacrifice certain wants, but they will get basic needs. And so, in that sense, it's a service that's also a business. We have made something of a need that we could provide for, but still maintain a nobility of purpose in our endeavor. And in this August Hall today, I'm happy to share with you that as Rotarians, as HMOs, we focus our service on those who need us the most, those in the periphery. Thank you very much and good afternoon.